Good afternoon, ma.
Good afternoon, Frank.
Ma,
How are you?
I'm fine. Are you?
Very fine, thank you.
Mm.
So is this going to be all virtual?
I
Meet?
think so.
Okay,
Yes.
okay, that's fine.
Regarding that, though, so that
Nigeria is a land of vibrant energy, vast resources, and rich cultures. But a shadow falls over the intensity of our uniqueness. How do you explain that over 70% of Nigerians lack basic health insurance? As the Nigerian Health Management Agency, this leaves almost 150 million vulnerable to harsh realities. Mountains, like any other commodities, in 70% of Nigerians have become more effective on this background routine. Who haven't been health education out in the almost 150 million for decades. Once increased cost of acquiring life-saving medicine has taken several drugs out of income Nigerians. Got the dosage or resort to often harmful alternatives.
I do buy hydro for my dad, Sinat. And that's now they're selling it for a rate of 4,500. Now it's 17,000 naira. I cannot even afford it. Now it's just I came to buy now. Because of the price, I could not buy it. Because of the rate of the price, I could not buy it. So I had to go. I go empty and cannot buy the drugs. I came to buy. So honestly, let the Minister of Drugs, let them just look for something they will do regarding this high rate of drugs, because people are going through a lot. Sickness don't they? Problem of the country that is telling on us. So many people are going through big drugs because of this, and the big medicine is very high. That really affected me. I'm even thinking of going back to herb, like the olden days matter now. We say yes, agbo. They say, "Oh my kifuane." Sorry, I'm not a English type and a Yoruba type. Me, I talk my dialect. I'm on my kifuane. I thought I do any more better. Drug, I'm a person.
In fact, most of the time we skip because once we finish it, I can't afford to buy another one. I want to do other things. So you have to skip, and it's very detrimental to what we are using for, especially the site.
The data shows that over 60% of drugs consumed in Nigeria are imported, making the country vulnerable to global price fluctuations. In the last year, prices of antibiotics such as Ampiclox, Augmentin, and Amoxil have skyrocketed by as much as 200%. Prices of medication needed to manage conditions like asthma and diabetes have also seen a significant increase, taking them off the shelves of the people who need them most.
I think the ones mostly affected are the asthma patients. GSK is the company that makes the most drugs for asthma. You have Ventolin, you have Seretide inhaler. Seretide used to be sold for 5,000. Now it's 50,000. That affected them a lot. In fact, there is a customer that came here and eventually brought the obituary of the wife. Said she passed away.
The problem was further compounded when GlaxoSmithKline, GSK, a major pharmaceutical company, discontinued the direct commercialization of its prescription medicines in Nigeria to take up a third-party direct distribution model. GSK attributed this significant change to a range of operational challenges. Similarly, Sanofi, another drug manufacturer, ended its distribution operations in Nigeria.
The exchange rates also affected the drugs because we don't really manufacture here. You see, they are all still brought in. And so the rate of exchange will affect the final price to the consumers. That is one. For us, it's not been easy because what I will buy with this box for probably 1 million, maybe about half of it now for the same price. I remember a colleague said, my staffs are stealing. I said they're not stealing. What your money can go back yesterday is not what it's buying today.
The message I have for the federal government and then the regulatory agencies, whatever they can do to reduce the cost of energy for the manufacturers, and then of course the cost of importation, import duties, and of course the exchange rates. At least we are happy that one is coming down slowly, but we just pray we go back to the people less than 500.
The day I was here, one mama, I did not know the mama. The mama said the drug that she's using is 1,050 naira, that she used to buy 1,050 naira. Then when she was there, she bought the drug 7,000. She was even begging for money. She came to me. I said, I don't have any money. There's one man in front of me that went inside his car to go and bring money for that mama. And the drug is a must for that mama to use it.
Okay, we have Silotrip. Silotrip, 4 mg, 8 mg. Basically, it's nowhere to be found in the market. And even if you see it at a very, very high cost, compared to when we buy for 3,000 something, now they're telling you it's something thousand.
The exit of these drug manufacturers has been blamed on exchange rate fluctuations and inflation within the economy. The naira has weakened considerably in recent times, and this has consequences for companies still importing drugs into the country. And addressing this issue has now become a matter of life and death.
On behalf of the cable, an online newspaper of 10 years service of distinction to our dear country, I hope you can hear me all. Are you hearing me? Dear participants, our guests, okay. All right. So on behalf of the cable and online newspaper of 10 years service of distinction to our dear country, I welcome you all to this webinar. My name is Dr. Henry Ewunonu. I'm a medical doctor and a public health advocate. This very important meeting is convened to discuss the escalating cost of medicines and medical consumables in our country. The objective is to conduct a diagnostic evaluation on the remote and direct causes of the escalating cost of pharmaceutical products and hospital consumables and provide actionable solutions for solving them. Your Excellencies, our special guests, ladies and gentlemen, it was in 1907 that Paul Ehrlich, a known German Nobel laureate in medicine and physiology, that first coined the concept of drugs being a magic bullet. He reasoned that drugs are special chemicals that are just like missiles that target the offending germs or microbes or abnormally functioning biological systems, corrects the damage or corrects the anomaly, but inflicts no collateral damage to the surrounding environment. This special missile we call drugs is like the arms and ammunition used by soldiers at the war front. That's what medicines, equipment, and consumables are in orthodox healthcare. They are what arms and ammunition are in conventional military operations. Where and when these essential and indispensable inputs are unavailable, unaffordable, fake and adulterated, sickness worsens, disability, other long-term complications, and unfortunately, death may be the outcome. The current reality today is that genuine medicines are scarce and unaffordable by many, while diseases ravage the land. Unfortunately for us, whereas others are in other parts of the world, they are undergoing what they call epidemiological transition, which is from infectious diseases. Since they've used vaccines and potent medicines to conquer infections, they are now looking at non-communicable diseases. Ours is what I would liken to an epidemiological vicious circle, from infectious or communicable diseases to non-communicable diseases, now reimagine communicable diseases. If it is also worthy of note that health is supported by other non-medical factors, mostly economic and social, referred to as social determinants of health. This includes income and social protection, education, unemployment and job security, working life conditions, food insecurity, housing, basic amenities, transport facilities, and the environment. In our country, the MBS says over 133 million people are multidimensionally poor, and also that over 70% of the population use out-of-pocket mode of payment for their medical needs. It can then be imagined how the crisis in the availability and pricing of essential potent medicines and medical consumables will impact on the health and well-being of the people. As it is said, discussing a problem or challenge is the first step towards solving it. The cable has assembled a very distinguished panel. In addition to the health managers of the country, led by #1 health worker of the country, the Honorable Minister of Health. To first understand the magnitude of this problem, underscore it as a challenge, then to be properly informed on what is being done to tackle it, and to further generate ideas and strategic solutions for results. It is on this note, on behalf of the organizers, that we welcome our special guest, the chairman of this webinar, Prince Julius Adewale Adelusi Adeluyi, officer of the Federal Republic, member of the National Institute, is a pharmacist, lawyer, entrepreneur, and former Minister of Health and Human Resources. He's the founder and chairman of Julie Pharma PLC, the first indigenous company quoted on the Nigerian Exchange in 1986. He's a past group chairman of Odua Investment Conglomerate and previously served as the Honorable Minister of Health, as I've noted before. He's a founding fellow of the Institute of Directors Nigeria, the pioneer president of the Nigerian Academy of Pharmacy, and a fellow of the Nigerian Institute of Management. He's also a former president of the Pharmaceutical Society of Nigeria, PSN, and chairman of MTN Foundation, a social investment vehicle of that telecommunications company, MTN. Prince Adelusi Adeluyi has held leadership roles with organizations like the Nigerian American Chamber of Commerce, and he's a member of the National Institute of Policy and Strategic Studies. He has received numerous honors, including the national honors I've stated before. So join me to welcome Prince Julius Adewale Adelusi Adeluyi. We have our special guests, the #1 health worker of the country, our own dear Professor Mohammed Ali Pate, commander of the Order of the Niger. He's a physician, an academic, a public health leader, currently serving as our coordinating Minister of Health and Social Welfare. He's a professor of public health leadership at the Harvard University's Department of Global Health and Population. Previously, Professor Pate was the Global Director of Health, Nutrition, and Population at the World Bank Group, where he also led the Global Financing Facility for Women, Children, and Adolescents, GFF. He served as Nigeria's Minister of State for Health between 2011 and 2013. He was also the Executive Director of the National Primary Healthcare Development Agency from 2008 to 2011. Professor Pate has held faculty positions at the Duke University and Harvard University, all focusing on global health. His work at the World Bank included leading health sector reform programs across continents of Africa, Asia, and other regions of the world. Please join me to welcome the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate. Without wasting our time, any further time, permit me to introduce the panelists who will dissect these issues today. We have Professor Moji Shola Christiana Adeyeye. She's a pharmacist and academic. She has been the Director General of National Agency for Food and Administration and Control, NAFDAC, since 2017. Previously, Professor Adeyeye was a professor at Roosevelt University and Duquesne University in the United States. Professor Adeyeye is a Fulbright scholar, fellow of the Nigerian Academy of Science, Nigerian Academy of Pharmacy, and the first African woman fellow of the American Association of Pharmaceutical Scientists. She founded organizations like Elim Pediatric Pharmaceuticals, Drugs for AIDS and AIDS Patients, Sarah Extended Family Homes for Children. Professor Adeyeye has authored over 60 publications in peer-reviewed journals, held licensed 5 patents, and mentored over 15 PhD candidates. Most recently, permit us to underscore this, that under the leadership of Professor Adeyeye, NAFDAC got the WHO pre-qualification status for the Central Drug Control Laboratory in Yaba, Lagos, which is the eloquent testimonial of this organization's commitment to meeting global standards of excellence in quality control and regulation of drugs. We also have on the panel our own Dr. Uchenna Ojimma, President of the Nigerian Medical Association. Dr. Ojimma is a consultant dermatologist, a senior lecturer at the University of Nigeria, and current president of the Nigerian Medical Association, NMA. Prior to becoming NMA president, Dr. Jimma held leadership roles within the association, serving as the second vice president from 2012 to 2014, for which he received a Meritorious Service Award in 2014. He was also recognized by the Nigeria Association of Resident Doctors with Merit Award in 2019 for nurturing and mentoring young leaders. Dr. Jimma, you are welcome to this program. We also have in the panel Dr. Frank Moneme, the Executive Secretary of the Pharmaceutical Manufacturers Group of the Manufacturers Association of Nigeria, PMGMA. He's an advocate for medicine security and has previously served as the Secretary of the West Africa Pharmaceutical Manufacturers Association, WAPMA. In his role at PMGMA, Dr. Moneme represents the interests of Nigerian pharmaceutical manufacturers and works towards ensuring access to safe, effective, and affordable medicines in the country. He has been a proponent of strengthening local pharmaceutical production capabilities and regulatory frameworks to safeguard public health. The last, but definitely not the least, is pharmacist Chisom Uchem. She is the Executive Secretary of the Anambra State Primary Healthcare Development Agency. Uchem oversees the agency's efforts to strengthen primary healthcare and ensure access to basic health services across the states. Under her leadership, the agency has undertaken initiatives such as ongoing recruitment drive to bolster the state's primary healthcare workforce. Uchem works closely with agencies, administrative departments, and representatives from various professional bodies to ensure effective implementation of the organization's program. Our special guests, ladies and gentlemen, you can agree with me that the panel is loaded. So we go on straight to take the opening remarks from our chairman, Prince Julius Adewale Adelusi Adeluyi, OFR MNI. Go on, Chairman, please.
Can you hear me now?
Yes, sir.
Good. First of all, I'd like to thank Henry Iwano. I'd like to thank you. I know you are a medical officer. I didn't know that you are quite good at being a master of ceremony. Well done.
Thank you, sir. Please go on, sir. Go ahead, sir.
Now, distinguished ladies and gentlemen, what a day we had on this occasion. I'd like to congratulate friend and brother, Simon Kolawole, for putting this together. But I'm not surprised because Kolawole has proved to be a very highly effective journalist and public speaker. He's also a media entrepreneur, an author, and I'm happy that his company, the Cable Newspapers Limited, has decided to put this together. It will be recalled that Simon was the youngest Nigerian to be an editor of a respectable national newspaper. Now, whatever he has touched from his youth, he has improved. Therefore, I know that this particular event is also very likely to add value to the various conversations and engagements which stakeholders and major players in the pharma industry have carried on rather intensively in the last 2-3 months. I think you're also quite fortunate to have the kind of panelists that you had gathered together here. Prof. Ali Mohammed Pate, I thank you for making time. You're the kind of leader that Nigeria needs at this time. You have shown sufficient concern as a coordinating minister of health and social welfare on this subject matter. And we want to assure you that the pharma world in Nigeria would continue to robustly support you in your efforts to solve this problem that has been very well put by the organizers of this day's event, addressing escalating costs of medicines in Nigeria. Let me also say that I appreciate the attendance of the panelists who are here in their right as the moderator, master of this particular event ceremony has put it. Each of you is very eloquently qualified to provide for us during this webinar guidance for getting out of this tricky situation. Distinguished ladies and gentlemen, I'm going to leave the details to the panelists, and I'm going to leave some other details to His Excellency, the Minister of Health and Social Welfare, but I'll just mention one or two things. We can be descriptive about all this. This has happened, that has happened, but we've heard it. And as the French say, all that is déjà entendu. We've heard it before. What I would rather like to learn from is a prescriptive approach, like you doctors do. We make prescriptions to make things better. So when the panelists are making their own comments, descriptive is okay, but the prescriptive will be more useful to the stakeholders and to the generality of Nigerians. Prescribe the few things that should be done to make sure that in the short run, in the mid run, and in the long run, the situation of medicine availability, affordability would be achieved in Nigeria. I'll just give one or two hints. Many African countries make long speeches. They write long policies. Some of the policies are as good as anywhere in the world. But when it comes to implementation, many African countries, including Nigeria, fall flat on the face, and that's why things are not moving. But then there comes a time when the real leaders are available. And I think with my friend and brother, Professor Pate, he's been a minister of state before. He's involved in international health strategy. And he's ready and willing to rejig the arithmetic of the pharma sector to make things work. So maybe the leadership problem is already addressed through him. But leadership is not enough. We must be specific as to the roadmap. As I said, many things to be said. Nigeria is not this, Nigeria is not that, but it is time for us, ladies and gentlemen, to try to reimagine the future, how things can be better. And as far as the pharma industry is concerned, I'll just make one point, and that is industrialization. In the short term, you can look for ways and strategies of bringing a supply to make people happy. But in the final analysis, you do have to go into industrialization. Listen to me. If you look at all the sectors of our economy, is it petroleum? Is it other materials of need for human beings? Most of them are imported. As long as they are imported, you do not have control over your currency value. And if you do not have your control on those, then costs of drugs and other things, inter earlier, become uncontrollably high. But when you start manufacturing, the stage is changed. What do I mean? Take, for example, the film industry in Nigeria. Those of you who are old enough will know that in the 60s and so on, we're all looking at James Bond films and Sound of Music, My Fair Lady, and things like that, all imported. But come the 90s, the film industry took charge. Today, the film industry brings billions of dollars into our space just by industrializing film industry. And you know, the film industry studied the situation in India, Nollywood, studied Bollywood. You know, Bollywood is a portmanteau word brought from Bombay and Hollywood in the US. Bollywood now makes thousands of films. Nigeria does so, and that industry is thriving. And very few people now look at all these foreign films. Now, if you now take this to the pharma world, industry came into India maybe 1901-ish. The first industry in Nigeria was M&B, May and Baker, 1944, September. But India has moved on with their various plans to the extent that whereas they were worrying about, like us, 30, 35 years ago, now they are no longer doing that because they've gone into industry in a big way. Today in India, you will find that there are over 3,000 drug companies. In India, you'll find that there are over 10,500 manufacturing facilities. Today in India, you will find that their production makes them proud. They produce enough for home demand. They command over 20% of global pharma supply chain. They address more than 60% of global demand for vaccines. They meet more than 40% of the generic demands in the US, and they provide more than 25% of all the medicines used in the UK. The pharma industry in India has become a dynamic pharma power base for the economy of India. Why can't we in Nigeria do that? Seize the opportunity of the moment. The pharmaceutical industry in Nigeria is at the very infant stage. The big companies that were here, majorly foreign, are leaving because of obvious litany of economic woes. But were we to be quite determined, that's why I'm talking of leadership, were we to be quite determined and have a good leader who knows the way, who shows the way, who goes the way, I want to assure you that there is enough human resources in the pharma world of Nigeria to make the industry happen. So that as you have Bollywood and Nollywood, you have the Indian industry and the Nigerian industry ruling many parts of the pharma world. Remember that all these importations we're having from Europe, US, China, and so on. If you look at the map of Africa, you can very neatly fit into Africa the whole of the USA, the whole of Europe, the whole of China, the whole of India. So were you to have an industry, an industrial base in a place called Nigeria, there's sufficiency, not only for us at home, but enough to satisfy the African market. There should be no delay. This, my dear friends, is the time to use the leadership we have now to ensure that we start immediately a dynamic strategy in industrialization in the pharma world. If we do this, we have very little to regret. We have everything to gain. It's a win-win situation. In any case, I can tell you, not starting it is not an option. I want to also open it up to say that, as some people say in Nigeria, Oge Chukwu Kama, God's time is the best. This is the time, the best time. It's not too late to start a groundswell of industrialization for making the pharma industry work in Nigeria. I will stop there and listen and learn from the very special people who have been gathered together. I'll make my notes, and I look forward to making my chairman's closing remark at the end of the brilliant presentations. Thank you very much, Henry. I want to leave you to continue your very brilliant presentation.
Thank you, Baba. You are our Baba. You continue to be our Baba. Thank you for that. If I had time, I would have given us a summary of this, but there's no time. I learned the Honorable Coordinating Minister of Health and Social Welfare is seriously time pressed. We know what you have been in that office, sir. So permit me to invite the Coordinating Minister of Health and Social Welfare, Professor Ali Mohammed Patel, to give his remarks. Professor.
Thank you very much. And the chairman of the occasion, Prince Julius Adulisi, I really appreciate your comment, but also appreciate the cable and Mr. Simon Kolawole for inviting me to say a few words at this very important event. And congratulations for the 10th anniversary of the cable, an amazing piece of online journalism, which we have followed for quite some time. I was pressed because one of my elders and bosses is actually here in my office sitting, and I was having divided attention with this panel or with the important conversation that we would have, which is on a related matter, I'm sure. The issue that you have picked on, which is the escalating cost of pharmaceuticals, is a very important issue, very close to our heart. And I think since November 2023, we have had series of engagements with industry players, with practitioners, with different stakeholders, realizing that that's a really important pain point for many Nigerians. It's part of a global phenomenon. It's also linked to things that are wider than what we are controlling directly in the health sector, but nonetheless, a very important issue. And for us in Nigeria, I believe, as the chairman hinted at, we're playing catch up. I think for 20 years or more, if we had built an industrial base to manufacture APIs, to manufacture some of our critical pharmaceuticals, we probably will have a much lesser impact from the globally increasing price of APIs and all the things that have happened on supply chains. But nonetheless, we are focused on solving the issue, and we've been working hard to do so through the presidential initiative to unlock the healthcare value chain, which, as you recall, Mr. President inaugurated or announced in October 2023. There are two buckets of issues underlying what we are observing now. The Nigerians are hot. Of course, there's the forex devaluation, which is on the supply side, the ability to buy the raw materials, to buy the equipment, the infrastructural deficit. I think while there is some infrastructure for manufacturing, I don't think it's at the level that you could say will meet up to the demand that we have. Other issues that go beyond infrastructure for manufacturing, including power, the know-how and technology itself, the supply chain, which has been fragmented, and the regulatory landscape. On the supply side, I think they contributed. But it's not only the supply side, but the demand side. The financing of healthcare in Nigeria and the affordability has been a long-standing issue for more than 40 years. Less than 10% of Nigerians have insurance or any insurance to speak of, which means most of our financing for healthcare is out of pocket. Hence, when prices go up, the medically related, the impoverishment due to cost of medical care also goes up. Nigerians get thrown into poverty. Many of us are a few steps away from poverty because of care. If you have catastrophic illnesses like cancer or kidney failure, it's easy because we don't have a viable insurance platform. And this is not today. This has been decades in the making to where we are today in terms of health insurance. So what are we trying to do? The president had directed that we work hard to find resolution as government, but also in collaboration with the private sector, because we have a mixed health system. Both sides have to work closely hand in hand. And hence, the engagement that we have had with the Pharmaceutical Consultative Forum, ably led by the chairman, but also many of the members who will be speaking on the panel have been part of that, along with the heads of our regulatory bodies. Very soon, I think we're just finalizing an instrument from government that will address the fiscal policy constraints on the import of raw materials and manufacturing equipment, but also on the market shaping. That's an instrument that signals from a government side intervention that we could do. In addition, to advance the medical industrialization agenda, we're inviting several actors with the technology to partner with our local manufacturers so that we have an industrial base as well, despite the challenges in the sort of ease of doing business that we all know. But still, we've got a viable market and we need to make a head start in that direction and shape the market. What do I mean by that? In terms of the regulatory framework, and I'm glad that DG NAFDAC is here and the Pharmaceutical Council of Nigeria that is enabling for domestic manufacturing and averting counterfeit and substandard products which undermine. So it's not only the prices that are going up, but when the prices go up, counterfeit and substandard, unless they are properly regulated, becomes an alternative, which also lead to loss of lives and undercut the market viability of those who are doing the right thing. And hence the effort on industrialization and market shaping towards that, and improving the supply chain so that we activate the demand that is in our country through pool procurement. And we're just about to embark that in the Federal Ministry of Health and Social Welfare to buy in pool and subsidize, but to channel the demand towards local manufacturers. And finally, the financing element of it. On the demand side, massive effort is underway on reforming the health insurance landscape. And we believe that if we can expand the health insurance landscape and have millions of Nigerians covered, then the ability of the system to pay for some of those cost of medicines, diagnostics, and medical care will not be borne by individuals and households, but by a third party. The absence of a third party payer is partly the reason why people are feeling the pinch from the rising cost of prices. Because if you've got an organized buyer, then they're able to negotiate prices and assure quality so that at the point of use, someone will only pay a co-payment, for instance, or even have the medications available. And I think NHIA and NAFDAC have been developing a medical supply chain initiative, which is trying to address that. All in all, to say that we are not unmindful of this challenge that Nigerians are facing. Just as we're facing food crisis, the rise in food prices, rise in other products that we don't manufacture at home, pharmaceutical prices also have escalated in cost over the last year or so. But is this a transitionary crisis? Nigeria is digging its way out of that. And I believe that in the next year or two, we'll see things stabilize, and even inflation that has gone up is likely to begin to stabilize and be under control, including in this arena. And as we industrialize hopefully we would mitigate against continued dependency on imports of the critical life-saving commodities, and even for the more expensive, so rarely used oncological products. Or hopefully we can be able to have measures in place to reduce the burden on Nigerians over time. There are two ways, the easy way and the hard way. I think we chose the easy way decades ago. The easy way is the harder way, while the hard way is the easier way in the long run. We are now choosing the harder way, which is to industrialize. It's tough, it has to be done, and industry is with us, and we in the government, under the leadership of the president, are committed to ensure that we pull through this harder way, because in the long run, it will be the easier way for all of us. So thank you very much for this conversation, and I will sign off here. Over to you. Thank you.
We appreciate you, Honorable Coordinating Minister of Health and Social Welfare. We appreciate your time, sir. We pray. You have been described by someone as a very experienced and skillful driver, the best driver that Nigeria can have now to drive this vehicle in the area of health. May you succeed beyond measure. Thank you, sir, for coming. If your guest is not disturbing, it will be nice if you can still find time so that you can listen to what others, especially those at the forefront or front lines, are saying. Thank you, sir. We appreciate you. So we will go on now to the panel.
So I will leave because the SGF is here. So thank you. Thank you very much. And I will follow the outcomes. Thank you. Bye-bye.
Thank you very much, sir. Thank you. We appreciate your presence. Okay,
Next one.
we now, yes, the chairman, you want to say a note of 1 minute?
No, let's go on.
Minister?
Let's go on.
All right, sir. So we go straight to the panel. I've earlier on introduced them, Professor Moji Shola Christian Adeyeye, DG NAFDAC, Dr. Uche Roland Ojimma, President, Nigerian Medical Association, Ms. Chisom Uchem, Executive Secretary, Anambra Primary Healthcare Development Agency, and Mr. Frank Moneme, Executive Secretary, Pharmaceutical Manufacturers Group of the Manufacturers Association of Nigeria. Each of the panelists will have 10 minutes to make their intervention. We will even appreciate if they make it shorter. So we appeal to them to be very punchy, straight to the point. Then please, listeners, participants, note your questions. You can be typing them down at the, use the icon for question and answer, type them down. At the end of the day, we'll harvest them for the panelists to provide answer. Thank you. So permit me to invite the DG of NAFDAC, Professor Adeyeye, to make an intervention. Prof.
Thank you very much, Dr. Egono, for this very interactive session. I would like to acknowledge the chairman, Prince Adeluyi, for organizing this, and for Cable One Executive President or CEO, Mr. Kolawole, for putting all this together. I listened very carefully to the coordinating Minister of Health, and he laid emphasis on decades of decay. What we are seeing now is a result of decades of decay. I joined NAFDAC in 2017, having lived outside the country for 37 years, and I met a different country. But right from the beginning, I knew that if we do not focus on local manufacturing, if we do not resuscitate our industry from the regulatory perspective, we will continue to have drug insecurity. What did NAFDAC do? We took the harder way. The harder way, just like the minister said, Honorable Minister said, is going to be the easier way on the long run. What is the harder way? We started strengthening our own regulatory system. You cannot give what you don't have. So we have to give international standards, quality approach to local manufacturing of drugs. In 2018, in Ilorin, the National Association of Industrial Pharmacists invited me. This was April, 5 months into resumption. And I categorically stated that we will change the paradigm. We will change the narrative from 70% importation to 30% importation. But when we've had decades of decay, that couldn't have happened overnight. But we started working. In 2019, we started the 5+5 regulatory directive. I gave that directive. What is it? We did a study where the top 5 drugs that are imported are also the top 5 drugs that are manufactured in Nigeria locally. So we said, okay, if you have been importing for 5 years, the last renewal will be the last renewal. During that 5-year renewal, you will have to migrate to local manufacturing. We did that in 2019 before the pandemic. We started unlocking the value chain before the leader, I will call him the leader for unlocking value chain, came up, and Nigeria became blessed with his presence, Professor Ali Patel. From that initiative, more than 30% of new companies in Nigeria are results of 5+5, because many importers started building their own companies or partnering with local manufacturers through contract manufacturing. That is access. That is the way to make drugs available, accessible. We also did another policy change in NAFDAC, what we call the NAFDAC ceiling, the ceiling 34. Drugs under those ceiling cannot be imported. Before my time, we had only 9 drugs under that ceiling. We increased it to 34 drugs so that nobody will import. We will not allow importation of those 34 drugs so that we can start waking up the dying industry. We can start encouraging local manufacturing. We import. Our manufacturers import everything except water. The active pharmaceutical ingredients, the non-active called excipients, are all imported. I challenged my colleagues in the industry. We need to start making some local, we need to start making some APIs locally. And that has resulted in EMSO making or planning to make, they've almost finished with the facility in Shagamu. They're going to be making 4 anti-malaria medicines or active pharmaceutical ingredients: sulfadoxine, pyrimethamine, artemether, lumefantrine. That is going to reduce the cost of drugs eventually. But we cannot start manufacturing locally without strengthening the regulatory. because we have never regulated local manufacturing of APIs. So we organized, NAFDAC organized a workshop that attracted 150 people October last year. Regulators, manufacturers, professors from the university, and their upperclassmen and women, Part 4 students, because NAFDAC is not thinking of today. We are thinking of the workforce of tomorrow. That is the efforts of the agency in terms of eventually reducing the cost of drugs. What has led to the cost of drugs? It is because of Forex devaluation. Overnight, what a company, a local manufacturer can buy for 3 naira, started buying for 10 naira, 12 naira. That was what drove the cost of drugs up. 2 multinationals left. And the hoopla that arose from that also caused some of those specific drugs, the cost to go up. The minister mentioned that when cost goes up, the unscrupulous people will start making substandard falsified medicines. NAFDAC is not asleep. Our work is 24/7 in terms of regulation and control of substandard falsified medicines. We do unannounced inspection for local manufacturing, for local manufacturers. It is easier to get to local manufacturers. So it's not just we are talking of access, we are talking of quality. It's not just medicine, it's quality medicines. We go after unscrupulous people outside the manufacturing industry. February 16 or 17 this year, we went after the open drug marketers. It has cost the agency a lot of money, despite the fact that we couldn't even access our money on time. Why? Because some of the unscrupulous manufacturers or importers use the open market as haven for substandard falsified medicines. We are also using technology. NAFDAC is leading in Africa, second leading in the world, using technology, track and trace, GS1 technology driven. Technology to make the supply chain visible. So in terms of what NAFDAC is doing, it is all about local content, which is the thrust of President Tinubu. But we started way before. But thank God that now we have a leader who is focused on local content. We are doing hand-holding with manufacturers, syringes manufacturers, beta-lactam drugs manufacturers, antibiotics, to ensure that they use international standards so that they can get pre-qualification, so that their products can, of course, add quality to the life of our people, but also be available for trading globally, so that our GDP can increase, our unemployment will decrease, and Nigeria will be better off for it. I thank you for inviting me to this very important meeting. I thank the chairman, Prince Adelui, for this. And thank you, Dr. Iguonu. God bless you.
God bless you, ma'am. Thank you for your interventions. It's obvious the problems are hydra-headed. There are too many, too numerous to mention. May you not be deterred. May you be encouraged. May you be given all you need to succeed. We will now bring in the president of Nigerian Medical Association, Dr. Uche Roland Ujima, who is representing a group that are the receiving end somehow, because they look for this medicines. They prescribe them, they write them for patients, and patients cannot get them. It looks as if they are not succeeding. Well, I will not take it from his mouth. Let us welcome Dr. Uche Roland Ojima, President, Nigerian Medical Association, for his intervention. Dr. Ojima, please. It seems Dr. Ojima is temporarily unavailable.
Okay, next one.
Yes, so we invite Ms. Chisom Uchem, Executive Secretary, Anambra Primary Healthcare Development Agency. Chisom, please. Yes, go ahead.
Good afternoon, everyone. I most respectfully want to thank the Cable One for the invitation. I also want to acknowledge the Honorable Minister for Health and Coordinating, Professor Ali Mohammed Pate, DG NAFDAC, Professor Deye, the chairman. I must acknowledge you. Thank you for your time, even at this particular video. You just deemed it fit to be here all the time. You came in at the right time, and you've been on. Prince Adewale Delusi Lee. I also want to acknowledge the presence of the President Enemy, DG Man, Mr. Frank Moneme. Please, I just want to speak a few minutes on what I think we should do to address the essential cost of medicines and medical consumables in Nigeria. I listened to our Professor DG NAFDAC. Madam DG, I want to thank you for all you have been doing. You know, before now, it's been weak regulatory control, high tariff, this, that, but having listened to you a moment ago, I am convinced that you are taking us to Eldorado, taking us to where we were supposed to be. Even when the pains are hitting hard on Nigerians, but I believe, God, that we'll get there. I want to just speak to us about what I think coming from the primary healthcare sector. You know, our Matter Declaration spoke about essential primary healthcare as that based on practical, scientifically proven, and that the cost will be affordable, at the cost that will be affordable and the community can, you know, get them. So when the cost of medicines are that high, when we have medication, people have need for the drugs, but they cannot get them, you know, there will be automatically therapeutic failure. When that happens, you know, the people at the grassroots are the worst hit. So now the question is, are there no alternatives? What can we do? What can we do? What more should be done that I think we haven't done before? So I started looking at government policies. This time around, I'm not looking at, you know, the taxes, having tax holidays. I'm not looking at, you know, an NAFDAC reducing some costs. I'm looking at policies of a government that will promote research enterprise. I'm thinking that if government will encourage clinical research, things, especially essential drugs, will be affordable to the grassroots, because this is the basic level of care. And anybody, if at that level you can afford to buy ACT, even analgesic, you know, this level, this particular category of products that our people can get at the grassroots, they were even thinking of scratching universal health coverage. So I think people come to our facilities and they say to us, my sister said that if I'm having pains, I should go and boil plantain leaves and I'll drink. And they said it worked for them. Others will even say, dogoyaro, mango leaves, that they will boil them and they drink and they are cured. And I'm thinking that it's time the government will look right inside to strengthen and encourage research. All of these lemongrasses, all of the guava leaves, all of the quinine, this quinine, most of the anti-malarials are taken from quinine, back of the. So why can we not encourage our people to go into research, to know the constituents, all those, active ingredients that will make somebody take herb and the person will fully recover. We can also look at NIMA, Nigerian Institute of Medical Research, and NIPRID, and see how we can help them, how we can support them, to get into research, so we can have our local brand, so we can have our local products. When we have our local brand, it will cut down on the prices of essential medicine. The prices of medication has so skyrocketed that some people say that NAFDAC is no longer there to safeguard any health, that they are now money spinning organization, but I don't believe that. So I'm thinking that amongst other things that we do to curb the high cost of medication in Nigeria, that emphasis and premium should be paid on government supporting and promoting research enterprise. I'm also saying that is government willing to support this research? Yes, we can say from part 4 in School of Pharmacies, we can get them into research areas so that by that time they are going to be useful. But the question is, would they be willing to support research when people are giving their 100% hands on that they are
Voice lost.
We can't hear you again. Touch something, please. Say something, please. We can't hear you. Say something.
Hello.
Okay, go on, go on. Go on, please.
Can I be heard now?
Voice is low.
Your audio. Speak louder.
Now, I want to talk about government willingness. Can you hear me? Please, can you hear?
Go ahead, please.
I want to speak on government willingness to support research. When people ability of the government to support or give incentive to those who want to go into research. Because please, can I still be heard?
Yeah,
I'm hearing
go on. I think it's your internet connection, but go ahead.
I'm hearing you. Go ahead.
So the government can give incentives to researchers, those who want to go into clinical researches. We also will look at licensing for imports. Some of our products that we need to. Can you still hear me? Looks, I'm losing everybody.
Yes, I'm hearing you.
All right, thank you. So we need to have regulation for our prescription products. We're also going to need to intensify unwholesome sale of products to open. If you get to the bridgehead and Onitsha, it's complete madness. So by the time we factor all this together, I think with support, as our Professor D.G. Nabak has just said, they'll be doing to ensure that we no longer depend on imports, but then we are going local to start our manufacturing, to develop our local content. I think this will go a long way, very long way, in bringing down the cost of essential medicine, so that our people who are really at the grassroots, who need this medication, who are not, too buoyant to buy expensive unquote products, will have access to so that the outcome at the end of it all will be better for every one of us. Thank you very much, everyone.
Thank you. Thank you very much. Chisom, are you done? Are you done? Thank you so much for your intervention. I don't know whether you can still hear me because you are started running in the central area, the central business district of Abuja. I hope I can be heard. The president of Nigerian Medical Association is back with us. We please invite him. Like earlier on introduced him, he's leading a critical mass of professionals who prescribe drugs. The patients can afford them. They come back the next day, the illness is getting worse. Mr. President, sir, your intervention, please.
Thank you very much. Thanking Mr. Simon Kolawole and also wishing the cable the best on their 10th anniversary. I will also thank the moderator of the task of moderating this important occasion. Barely 2 weeks ago, and it's kind of very, very important for me. It's in the front burner. It should be in the front burner of our national discourse. That is the way I see it. Because in life, a proper assessment of any country is a matter of a combination of their economic and health indices. That is what you use to decide how viable a country is. And of course, the nature of progress that is expected. I'm sorry I was available the initial time I was invited to speak. But somehow when I joined with my laptop, it seems I was brought in as a part of the audience. So I couldn't even see myself. So I had to switch device. Now, let me point out the implications of what we are discussing today. I want to be, how do I put it? I want to be real about it. I don't want to be academic. It is simple. A simple example, what Henry pointed out initially, that in Africa, which includes Nigeria, we have what is called the dual disease burden. What it means is that we are still battling with both infectious diseases and diseases of chronicity, and maybe disease of lifestyle, while the Caucasians or the developed world is battling majorly with diseases of lifestyle, hypertension, diabetes, mellitus, and so on and so forth. An important thing to point out here is that when you have a dual disease burden, it puts both extremes of your population at a great risk. So you'll be losing people from the top, the elderly, and you'll be losing people from below, the under fives and the young. And that is never a good outcome. It will reduce the quality of life your people live, increase your mortality rate, and of course, drop your life expectancy. And let me tell this country that when you have these three things I have mentioned, you will not attract foreign investments. So we must understand the role that the healthcare indices play as it pertains to attracting investments to our country. So let's be serious. Let me also point out that Nigerians are going deeper into poverty as a result of inability to, as a result of purchasing health care. We just pointed out that over 70% of us rely on out-of-pocket expenditure. And we have multi-dimensional poverty skyrocketing. So it's going to get worse. And the implication of worsening poverty is worsening insecurity. So when you put it all together, the health sector is important because when the people are sick, their productivity declines. So our policymakers, I thank Professor Pate for being part of this program briefly. I have a high regard for him. But I think our policymakers should stop telling us about plans. There are too many plans. There are too many things to be rolled out. Let us roll out things. Let us start rolling out these programs before we roll them out too late. And the people we are rolling them out for have all gone or have lost confidence in us. Let me say this. As a medical doctor, your greatest anger, your greatest despair is the inability to treat your patients. And it has become worse. We used to talk about lack of medical equipment. Now we are talking of lack of drugs. A simple analysis, I will not name names. A particular brand of valsartan, which is an antihypertensive that we prescribe commonly. Early last year was somewhere around 4,000 to 7,000 naira for a month's dose. Today is going for 39,000 naira, and our minimum wage is what? 30,000 naira. If you add the wage award, which is for 6 months, it comes to 65,000 naira, and you are going to spend 39,000 naira to buy a 1 month dose of drugs. Obviously, that patient will come back if you prescribe that drug, and they will demand cheaper alternatives, which we have explained here will lead to purchase of fake or counterfeit brands because you may not be able to find a good and worthy substitute. This also frustrates the doctor, is one thing we don't remember, and it is now a contributory factor to brain drain among medical doctors. They are living to where they can write drugs and they are sure of the quality and they know that the patient can afford it. At this juncture, let me say that Nigeria needs to urgently, because we don't do things. The military mentality that has affected us has made us to only function better when there is a declaration of an emergency. So I think our government should think about declaring a state of emergency in the health sector, especially the pharmaceutical sector, with emphasis. Now, my friend Moneme is here. They are ready. They only need the prompting. We have talked about, the chairman talked about Bollywood and Hollywood. And of course, the Indian pharmaceutical sector, we know what they did in the era of lack of affordability of anti-HIV drugs. Okay? They went ahead to grant their people the permission to produce generic versions that even today Americans are also importing. So Nigeria should go full blast, support our local manufacturing sector as far as pharmaceutical industry is concerned. Of course, they must be properly regulated. That's why we have NAFDAC, so that they do not produce chalk for us, but they need support. When you talk about this need for support, people will always tell you there is a fund in the central bank that is supposed to be used for the healthcare sector development. And I always tell them that none of my members that have tried to access it found it easy. It's easier to actually, how do I put it, to actually acquire a visa to one of these Scandinavian countries than to access that money that is in central bank. And what we in the Nigerian Medical Association believe and have always said is that it is anomalous for a country to have bank of industry, have bank of trade and commerce, have bank of agriculture, and they do not have any bank for healthcare sector. I think Nigeria should develop a health sector, should inaugurate a health sector development bank that will have different facilities for all the healthcare sector contributors and stakeholders, such that they can go to this bank, fulfill the conditions, which should not be also as stringent as the one in the central bank, and acquire it. They can encourage all these pharmaceutical sectors to go into this production of what we need today, which are antibiotics, antihypertensives, anti-diabetics, and so on and so forth. So we call for a serious action, no longer plans and things to be rolled out. We want things that have been rolled out. Let's roll out a health sector development bank. Let us help the local pharmaceutical industry. Let us reduce the cost, the import levy on importation of these drugs, and also the equipment for production of these drugs. If we put our acts together, we will be the greatest beneficiaries because our economic productivity will rise. We will attract foreign investors that we usually travel abroad to go and woo. Meanwhile, our members and our citizens that are going to be the human resource for this productivity and these investors are dying and are ill. Okay? If we cannot do that, if we cannot bridge the inequality in the health sector, where those that are rich can afford the drugs and so remain stronger and healthier and produce more and get richer, while the poor is on a downward spiral, we will have a problem in our hands. There is a point it will get to. People will no longer sit in their houses and die. They will move into the streets and seek a solution. So the Nigerian Medical Association calls on government in summary to declare a state of emergency in the health sector. 1, we want a health sector development bank. 2, and we want targeted facilities for the entire health sector, but on this issue with emphasis to the local pharmaceutical industry. We also call for federal government to give import waiver for these drugs to reduce their cost and also the equipment that will be used in manufacturing of drugs. Thank you very much, the chairman and the moderator. These are my little inputs that I think are hands-on. God bless you all.
Thank you, Dr. Jimma. Participants, I hope you are noting your points. There is Bank of Agriculture, there is Bank of Industry. There was even sometime one initiative to promote Nollywood.
Yes.
There is no bank for the health sector. The last but not the least, let us invite Mr. Frank Moneme, who is actually representing the manufacturers. What is happening to manufacturing of essential medicines in Nigeria? Mr. Moneme, please. Thank you.
Thank you so much for inviting me to be part of this panel discussion. I must congratulate the Cable newspaper. I must say kudos to you and your team. In your 10 years, you've done a great job. I must acknowledge the Honorable Minister for Health, the Coordinating Minister, Professor Alipate, for finding time to be here. And of course, my Lord Pharmaceuticals, Prince Julius Adewisi. And then, of course, other panelists here, Professor Moji, our own DG NAFDAC. I'm not going to flog on the reasons why the rising cost of products. If you look at the documentary, you already alluded to why. And of course, Madam DG also spoke on why. The coordinating minister also made emphasis on why also and what they are doing. But then I just want to put it this way. The prices of medicines, the rising costs can be alluded to 2 categories, the direct costing and the indirect cost. And then if you look at the direct costing, you should be looking at those things that we don't have control over. And if you look at the indirect costs, these are the ones I think we have control over. We can make immediate changes on that based on policy, based on monitoring, based on evaluation. If you look at the direct costs, we are looking at energy costs. Manufacturers, like one of the companies mentioned, as of last year, the cost of energy to power his facility monthly is at the 40 million naira per month. And then presently, they are powering their facility with 150 million per month. And I can also tell you some other companies, they have also within. And in the source of energy, you look at the public power holding companies, which is most times even dollarized. Yes, you pay your cost is being assessed based on US dollars. So diesel costs as of last year, you have it at the rate of 650 per liter, but now is around 1,550 and 1,600. So these are direct costs that we don't have control over. And I can, these are all inputs, the end users, the product that is shown out from your facility. We're also looking at, of course, you all know the impact of the unification of the forex. Even as we speak today, Nigerian customs is not steady. Is today you have this cost, tomorrow you have this cost. And as a manufacturer, you look at it's just microeconomics. It might pay rising costs. The end user, I can tell you the local manufacturers, they are to put in all the costs. The average Nigerian cannot be able to afford any medicines. The prices will be up high. But then we are here, and I am happy and excited we're having this conversation. Sometimes I think that we had a missed opportunity in COVID-19. Before COVID-19, PNG man, then under the leadership of the then chairman, Dr. Kiapa, and the secretary, PNG man conceptualized what we call medicine security strategy documents. And I just want to emphasize on that so that it will help us understand that we approach in solving this problem. And medicine security documents, we've done this presentation and actually emphasis on except you are in control on the driver's seat on how the medicines that you consume are produced, except you're on the driver's seat end to end how these medicines are from the inputs, pharmaceutical material to to fish product to the distribution to the last mile delivery. Except you have strong efficiency in regulating because you are strong as your regulator. Until we are in control of this, access to safe, access to affordable medicine, access to quality medicine will continue to be a mirage. So affordability is one element of that strategy that talks about access to medicine. And then this was conceptualized, before COVID-19. And we're saying that the local farmer need to be prioritized. When I say prioritization, you are looking at from fiscal policy, monetary policy, regulatory, trade policy. They must converge. There must be a convergence to speak to driving that sector, not a fire brigade approach. That's why I said it looks like it's a missed opportunity during COVID-19, because during COVID-19, there was a lot of discussions around how do we prioritize this sector. So I mentioned about the direct cost, which one of them is also because of the cost of diesel, end-to-end distribution, movement of goods from one place to another is also, you have to factor in the cost. But then the ones that I think that, because most of us know actually the impact of the direct cost, which inflation, macroeconomics, dynamics, led to that. But the other aspect that's for me is very important for all of us is the one why do I call it self-inflicted? A target to make so amount of returns, and they go out there to make this return because that's the mandate. At times you see that they are not striking a balance between revenue driving and then trade facilitation. Let me give you a typical scenario and example and how it also impacts to costs of doing business. I will look at this way, ease of doing business, because that's the elephant in the room. A man, please, I need your assistance. I said, sir, what is it? He said, can you imagine that the product has been imported and input, mind you, considering the forex high rates, now this one, they are saying that the importer, the manufacturer that imported the pharmaceutical raw materials undervalued what he declared before the customs. And he could not understand what metrics are being used to do this undervaluation. And the challenge now is he's looking at, this is something I've been doing in the last 10 years. And if there is a total inflation at the global stage, the price differential is not going to be much. And here, they are saying you undervalued, you are going to pay so amount of money at the level of almost 100% increment. And he said, no. And because, for a government that have good governance, what happens is that you must sort out this problem. And in trying to sort out this problem, what happens is that you are either caught in between paying for demurrage, or we have to get to Abuja and you're writing a letter to protest. And in the midst of this back and forth, mind you, there's a disruption in production cycle. Now, at the end of the day, you solve this, who pays? Who pays for the extra cost? It also happens to most organized pharmaceutical companies like the multinationals that left. I know that also most times when they're caught up in this, they have to send people to Abuja, PwC, or S&Young to solve this problem. At the end of the day, there's a cost. Who pays for this cost? The end users. So you now discover that we need to find a way to streamline. How do we drive to make sure that these self-inflicted costs are totally eliminated? They are telling you, oh, that the HS code that you use in bringing these goods is not the right HS code. For you to resolve this, it takes a cycle that is so long. So I am glad that the new government, there's a lot of things in behind the scene. The Honorable Minister is working hard to, you heard him talk about this, the order that they are looking forward to work that is before the Mr. President, that all these things are tied to it. But I think while we're looking forward to the big picture, that there should be a kind of task force. And that's this task force, I want to be likening it to the kind of task force we had during the COVID-19. And this task force is an emergency operation committee. And this task force was real-time, hands-on. We are able to focus on clearance of goods that for legitimate manufacturers or people that bring in the right things. We have a task force that comprises of the finance, the finance, trade and tariff, the Ministry of Finance, PVAC, the Presidential Unlocking the Value Chain. We have the manufacturers real time, so that when there are things like this, we escalate it and solve it real time. These are self-inflicted and add to the cost of doing business. And I must say also that another way to alleviate this challenge is also we need to see how we can optimize our health insurance policy. Our health insurance policy today is not is underutilized. We must find a way to get it working so that people will be protected from paying catastrophic out-of-pocket expenses. And the other strategy I think that we can adopt is a discussion behind the scene, which today PNG Man is partnering with some local manufacturers, some state governments to do what they call pool procurement. So if there's the need of paracetamol, we buy in bulk and then and supply those states. We're in partner with about 7 states. Is effective. That model, most importantly, why I must commend the team for putting up this conversation. We need to have a work approach in this, just like we did in COVID-19. We need to look at that every local pharmaceutical manufacturing will respect to access to finance policy and regulatory policy. They must be able to harmonize this policy to transform the pharmaceutical manufacturing sector. And by so doing, I can tell you that we'll continue to close the gap in access to medicine. Interestingly, that most of us are in business today is we are not profitable. What we are doing is holding forth because it's a call to service. It's patriotic work. Thank you.
Thank you, Mr. Frank. Thank you. I'm sure that if we give you 2 hours, it will not even be enough to dissect issues in the pharma sector. We'll go straight to the question and answer session, and we have some of them here. In no particular way, I think our panelists will listen carefully. I wish the Honorable Minister or the SA on unlocking the value chain is here. But anyone you feel you can handle, including our chairman, who is about one of the most experienced participants on this platform, please go ahead and provide us with the answer. So the first question, which we have planned from the question and answers the participants have sent. Number one is, how best can the system handle the high costs of pharmaceutical products as the cost is beyond the masses of the nation? I think it's related to what the NMA president is saying and declaring a state of emergency in the sector. We have a problem that requires more than the ordinary. I don't know who can help us answer this question. The participants, we can also generate ideas which the cable will use, because there will be a post-event feedback to the Honorable Minister and perhaps to the Federal Executive Council. How best can we handle this high cost of pharmaceutical products that is strangulating the average Nigerian, while the government will now have time for industrialization and other things? But today, the person that needs ceftriaxone, if he doesn't institute it in the next 6 hours, the patient will die of severe sepsis. What do we do?
Thank you. Can I try?
Identify yourself and speak, please, and please be just a minute.
My name is Dr. Ucho Jima. I'm the president of Nigerian Medical Association.
Okay.
I want to say that when I say declare a state of emergency, I wasn't joking. You see, until the Nigerian government links up adequate healthcare provision to economic viability, they will not take it seriously. The most important thing for me to do today is, one, bring down the if there is what do they call it, costs, taxes on importation of these drugs.
Tariff.
That is one.
Importation
Tariff. Thank you very much. Bring down the tariff immediately. In fact, remove the tariff totally for a while, such that people will be encouraged to bring in these drugs and it will drop the cost. That is one. At the same point, start funding the pharmaceutical health sector with soft loans, with moratorium, so that they can produce generic forms of these drugs while we head towards full empowerment of our pharmaceutical sector to go into full production. If our film industry could do it, our pharmaceutical industry can also do it. And the second part is that it has become imperative for the health insurance to be expedited, such that many Nigerians would come under the umbrella of national health insurance, which will cost down out-of-pocket expenditure. If we put this together, I think it will help. Thank you.
Thank you. Thank you very much. We'll go to the next question. And I think Mr. Frank and our chairman may speak to this. how does Nigeria bridge the gap created by the exit of foreign pharmaceutical countries? DG NAFDAC too can speak on this. How can Nigeria bridge this gap that has been created by the exit of foreign pharmaceutical companies? Yes, one minute, please. Yes, Mr. Frank, the chairman, DG NAFDAC, who can speak to this? In fact, I would prefer all of you speak to these issues. All of you.
Let me quickly speak to it. I have another meeting in about 10 minutes. Let me quickly speak to it. With the exit of the multinational companies, the way we can tackle it is to have more local manufacturers making those products. And how can local manufacturers make those products quickly? It is for the Forex devaluation, to stabilize, the Naira to stabilize, and it's stabilizing now. So it's not a solution that you can get overnight. There is nothing that those multinationals are making, or were making rather, or I'm still making, that we cannot make in Nigeria. The one item that we cannot make, now that I'm thinking back, is inhaler. And when this issue started, we contacted pharmaceutical companies, or pharmaceutical companies contacted us. Can we import this? We gave them special permission to import. So that is part of what NAFDAC can do. We react to shortages. If a company says we have done X, Y, Z, and we confirm that there's shortage, we ask them to import, and we give them faster registration process, expedited registration process. These are the types of means to reduce the impact of exit of multinationals. Over. Thank you.
Thank you, Prof. Before you leave, a question just came in, and before Frank comes in, it says some locally manufactured drugs are more expensive than imported brands of the same product. What is NAFDAC doing in regulating prices? Is NAFDAC involved in price regulation, Mark?
NAFDAC, thank you very much. NAFDAC does not regulate or control prices. We control access. We do make sure that products are accessible. That's why we started 5+5, local manufacturing. That's why we have ceiling. If local manufacturers' prices are higher than imported, first two things may be happening. The reality is that local manufacturers import everything. But sometimes it may be because some of the products that are being imported may not be of quality. If they get, all sorts of active ingredients or whatever raw materials to make it, they may bring them in cheap. So if it is too good to be true, it is too good to be true. It may not be true. Very likely it will not be true. So the fact that local manufacturers' costs are costlier or are higher rather is a reality, but that reality has two prongs. First is because water is the only thing they import, and it has to be a little higher, but it may also be because of less international standards that they included in importing. It may just be, that's part of the reason why we are after open marketers. People bring in all sorts of things through porous borders, also through porous borders. So the fact that a drug is cheap doesn't mean that drug has quality. So the buyer must be very, very careful. Where do you buy the medicine? Do not buy medicine from the street corners. Buy medicine from pharmacies, from pharmacy practice settings. If you buy from the drug corner or from the open market, you may get bad medicine. Thank you very much.
Thank you, Prof. Finally, before you go, perhaps one of us on this meeting, perhaps a researcher, wants to know if there is data on the volume of expired medications recovered by NAFDAC. What does NAFDAC do with the expired medications? If such data is, where can he access it?
Where can they access
it? The data on expired drugs.
We do not make available expired drugs, if that is what the person that asked that question meant.
Data.
Say that again.
Data on expired drugs, man.
Oh, data on expired drugs. Our investigation and enforcement is the directorate that handles expired drugs, confiscated drugs, substandard falsified medicines, counterfeited, investigation and enforcement of NAFDAC. And they have the data and on the volume of expired drug that they destroy. We do destruction every quarter per zone, and then we do destruction also in the Southwest zone and Lagos zone, maybe twice a year. But in terms of the volume, it is the investigation and enforcement that will have that.
Okay, thank you, Ma. And we appreciate, even if you leave by now, though we want you to stay to the end, but we are indeed very grateful. So for time's sake, we will now
thank you, DG NAFDAC.
Thank you, sir.
You continue to impress me.
Thank you, sir. Thank you, sir.
God bless you.
Thank you, sir.
Thank you. So for time's sake, we will now call on the panelists to give their final words. They can do that. They have listened to the questions being asked. They can use the opportunity to answer those questions. Please make your interventions less than 2 minutes. The panelists, Mr. Frank, can start.
Okay. Once again, I want to thank Cable people for putting up this highly interactive forum. I must say that as a country, we need to start seeing medicine security, being able to manufacture our own medicines, comparable to national security issue. There's a linkage between medicine security, national security, and even achieving the universal healthcare coverage. It's important that we put that in the forefront, or else we'll miss the opportunity of COVID-19 if we don't, approach it from a very different strategy. We also miss this opportunity. It's an opportunity for us to reverse, the dependency of Nigeria on imported medicine. And I want to say that the statement made that locally manufactured medicines are more expensive is not empirical. But then I must also tell you, we have a lot of borders in Nigeria that are not manned. And these are one of the greatest fear of most of us. If because of the high rising cost of goods, the country will face with a lot of counterfeited products coming into Nigeria. We as local manufacturers, we are doing all within our control to see how we can stem the prices of medicines going up. And part of the things we are doing is engaging government. We've had in the last 1 month, we had meetings with the minister almost 3 times, Minister of Health, very committed. And we want to believe that at the end of the day, we'll come up with a better strategy that will turn things around. Thank you so much for giving us this platform to share our views. Over.
Thank you. Ms. Echem? Chisom Uchem, sorry. Ms. Chisom Uchem, are you still on? Okay, we'll call on the NMA President, Dr. Ojima, for his final word.
Even though my network is having a little challenge.
Thank you
again
very
for having
much.
us talk about it.
Okay, sorry, it's like HM is around. Chisom, are you here? Okay. NMA president, please.
Thank you very much. Let me start by thanking Mr. Simon Kolawole and the cable for this opportunity. I thank the chairman once again, His Excellency and the former Honorable Minister for making our time to be here. Thank you to the moderator of this occasion, fellow panelists, and all those that participated. In conclusion, it is the position of Nigeria Medical Association that we should move from planning to roll out things to rolling them out. We should increase the penetration of the national health insurance, bearing in mind that it reduces out-of-pocket expenditure and can make it easy for these drugs to be obtained. And of course, the process whereby national health insurance is working on being able to provide all the drugs prescribed under their umbrella will also help in solving this problem. We call for the government to link up good health indices with good economic outcomes. Once that particular simple arithmetic is made and the answer is acquired, it will fire them up to invest more in the health sector. And finally, we still insist that Nigeria needs a health sector development bank from which the support for the pharmaceutical industry and other participants in the healthcare sector will come as facilities targeting this particular sector. Thank you very much for this opportunity. We wish you all the best.
Thank you, Mr. President. We realize that Chisom Uchem is having some issues with our internet. So we invite the chairman who has stayed very, very patiently listening to all the discussions to please round up with his closing remarks.
Okay, gentlemen, ladies and gentlemen, those of you who are panelists and those of you who are on the list of about 154 people there virtually. There will always be talk about medicines. There have been, there are, but it's not just words. I'm very impressed by the NMA president, young brother Uche, who says we must be real and get away from planning to action. Uche, in 1974, the NMA invited me to be a guest speaker, and one of the refrain sentences was that we must get real, we must move away from planning and have action. That's in the 70s. It goes to show you that this country would continue to repeat itself and learn nothing from history as long as we make wonderful policies and we fall flat on implementation and get away with it. People don't implement and they get away with it. I would say that we should address the outcomes of this discussion this afternoon. Remember that in this, there are people who are virtually here who have strong opinions and they want to express strongly, but these facilities would allow them, neither would time. First of all, let us see that the condition of obtaining medicines has become difficult to assess. You can't afford it, and you can't be sure of many of the medicines. So what do? It still has to go back to the authorities. That's why I'm happy that Professor Mojisola has made very clear some of the things she's doing. But I think the following are important, just for us to wrap up. One is that it is very clear now that for us to go forward, we need a realistic public-private sector partnership. if we have that to address the issue and we collaborate, actions can be quicker and easier. We need to address the issue of the regulatory challenges. NAFDAC is working hard, but NAFDAC has to be appreciated. Perhaps they need better advocacy and communication. Otherwise, they could be misunderstood with their good intentions. And you are people of the press. No matter how good the idea is, if it's not well packaged, it can be misunderstood. Like she was talking about some alcohol sachets recently. There's also important to visit the policy reforms. Some of the policies are very archaic and they need to be reformed. And then the private sector must, if they agree and understand these reforms, champion it in such a way that we have results in the area of implementation. The issue of funding is very important. And I hope that in the documents of the organizers of this, one of the outcomes will be to say that funding is important. I think it's Uche again who talked about a bank for healthcare. Those of you who are following healthcare matters would know that during the COVID-19, the CBN had a credit support for healthcare unit. What's happened to it? How is the implementation going? These things should be followed. And as for funding, what can be done immediately now is to make sure that whatever is available now within the various institutions of health throughout Nigeria, we must use them judiciously along areas of accountability and openness, such that we do not, in fact, through fraud and corruption, waste it away. There are very many things happening that make these costs much higher. I would suggest that we address the heads of various institutions, private and public, to use what they have now to get what they want, pending certain things that will happen positively from government. And I think also somebody mentioned very wisely the issue of R&D. Professors in the universities are doing a lot of R&D, but the results of many of their jobs is lying there in the dust. Nobody is implementing any of their recommendations. Whereas R&D has got so far in the developed nations that they meet the urgent present requirements. Take, for example, a drug called Lemdley. Lemdley, this is the latest drug now. It is the most expensive drug on earth. It's a result of research and development. The Americans have now discovered it, and the NAFDAC equivalent in America said it can be used in gene therapy, in MLD, in the loss of motor cognition functions. You know how much that costs? It is the most expensive one single item of drug in the world. It costs $4.25 million. So that's another world. But in our own part of the world, let us do some research into our local fauna and flora. Somebody mentioned Dogon Yaro. A lot of research has been done in that area. A lot of research has been done in sickle cell anemia, which is a black man's burden. Government should fund some of these and take them from research in vitro into in silico into what we call commercialization levels. There is also the issue of manpower. So these are things that Cable should put in their report as the outcomes of this discussion. Manpower is a challenge for developing nations because we spend a lot of money training these young people, and as we are told, they get frustrated, no equipment, no drugs, and they japa. Some of them who japa are very willing and ready to come back because they have found that working conditions there can be very, very challenging. But they're not coming back because the situation here is not getting better. So the training in our universities have to be such that the products are fit for purpose. So I feel like we're doing these things well. Something that gladdens me that the minister didn't talk about, which I hope they will talk about, is the executive order from the president of this nation. He had hinted that this would be there, and if it is there, it will solve many problems like NHIS, production of APIs, and several other things that have been mentioned here. Let me now say that it's important for me to congratulate our dear friend and brother, Simon, and his organization. First of all, for achieving 10 years. It's not easy in this country, but also for thinking that as part of the 10-year anniversary, he would organize this kind of event. I want to congratulate you for thinking this direction and for bringing together the kind of caliber of people that you have brought together, not only on the panelist level, but I have scrolled through very many names of doctors, pharmacists, nurses, and ordinary activists who are ready and who have gained by listening. I think you should make yourself realize that, Simon, you should make yourself happy that you have done it again. You've done it in very many areas before, and you're doing it again. So you remind me very clearly of one of your friends, and I know you know him, Simon. There's somebody called Josiah Gilbert Holland. He was a journalist like you, an author like you, a columnist like you, and his views really, he lived in the 19th century from about 1819 to 1881. His views influenced the very matrix of the American nation. And those of you who are interested should in fact check this up. He wrote something called God Give Us Men. Check it up and Google it. It is the kind of thing that cable should be promoting now. Nigeria is in need of men who can be dependent upon. Nigeria, that's give us men, it says, give us men who are men of honor. Of course, when we say men, women are involved. Men who have strong mind, men who have great hearts, men who have true faith, men who have ready hands, men who the lust of office would not spoil, men who have character, who respect themselves, respect others, and take responsibility for their actions. If we have such men at all the levels, whether it's the presidency of the NMA, of the PMG man, or even of, not to talk of the government leaders, if we have that, we must pray for that. Nigeria will change. We are at the moment being used as the raw capital of the world. We are the ones who are at the bank of the river crying that we are thirsty. We are the ones who have all the crude oil and we still cannot control the prices. But when we have the right men at the right place, at the right time, also encouraged with the advocacy, you'll be surprised that Nigeria will change. It is time for us to change the optics of the nation, the ecosystem of the nation, and the success value of the nation. This is one way of doing it, what you have done, Simon, and I praise you. And I thank all those who have participated, ranging from Honorable Minister to NAFDAC, to the young lady who is in Anambra, the primary health care, to the Aluta Continua president of the NMA, and of course to the moderator. May God Almighty make life easier for each and every one of you and your relatives, even in these difficult times. I thank you for inviting me.
Thank you, and thank you again. I wish there's a greater phrase than thank you. Thank you, sir. You have been there, you are here, and you continue to be here. May the good God, despite celebrating several years, make you see a better Nigeria. You will see it in your lifetime. Thank you, sir. Thank you, our panelists. We are grateful to all the participants that have asked questions. Professor Clara HMB, Prince Agbo, Joshua Aderinde, pharmacist Omachiko Adedamola Aderoju, Ukamake Okafor, Mlawan Emeka, Osaro Lawrence, Okatuchike, Adebayo Abubakar, and others who have made contributions. I've been told to inform you by the cable that your questions will form part of the feedback to the minister. And one thing I've been also told to reassure you that one thing that must happen is that facts, points made at this meeting will be communicated back to this minister, and it's coming at the right time before this much talked about executive order is issued. We will not forget the intervention of the NMA president in saying, please call for a state of emergency in the healthcare. We will not forget that making medicines, essential medicines available is a task for today. The minister said by 2 years' time, things may stabilize. I wonder how many people that will die before the next 2 years. So thank you, the cable. Don't leave. There is a documentary that we played after now. Simon Kolawole and staff, management of the cable, congratulations once again on your 10th anniversary. Let's please watch the documentary before we exit. Thank you all.
Energy, vast resources, and rich cultures. But a shadow falls over the intensity of our uniqueness. How do you explain that over 70% of Nigerians have basic health insurance? As the Nigerian Health Watch revealed, this leaves almost 150 million people vulnerable to a harsh reality, the rising costs, in journalism in pursuit of Nigeria. On the 29th day of April 2014, Cable Media and Publishing Limited launched the Cable newspaper to drive its vision of knowledge-driven journalism in pursuit of Nigeria's progress.
You set out to be what we call the top-notch professional online newspaper in Nigeria. As at the time we started, there were so many sites offering news, and there was some kind of skepticism about the quality and the reliability of the information you're pushing out. So we said, okay, we're going to do something different. We are going to deliver knowledge-driven journalism in the pursuit of Nigeria's progress. So in that, we spoke about the knowledge, we spoke about the progress. So it tells you something about our attitude. It's a positive attitude towards the development of Nigeria.
Our platform offers a comprehensive news experience encompassing politics, business, development, climate, sports, and entertainment.
One of the things that we talk about is the fact that we consistently overachieve most of the things that we set out to do. So if we have a goal to achieve something in 1 year, in a few months, we would have already achieved it. So yes, we have achieved our targets. We have surpassed them by a mile, and we have set even new targets.
We go beyond the headlines with exclusives, fact checks, insightful interviews, and impactful investigations. Our features, analysis, explainers, timelines, profiles, and obituaries set us apart as industry leaders.
Over the past decade, the company has not only thrived in the dynamic world of digital journalism, but has also set new standards in staff welfare development.
We came up with a lot of things to try and deliver journalism in a more professional way, in a reliable way, trustworthy. So when people say something's on the cable, people say, oh, it must be true if it's on the cable.
And as the media space evolved, so did we, in our continuous pursuit to offer value, embracing technological advancement to reach wider audiences and enhance user experience through credible, independent journalism delivered in a format accessible to a new generation. The cable won the 2022 Google News Initiative Innovation Challenge to build and deploy the Cable Dinner, Nigeria's first disability-inclusive news application designed to assist people with visual impairments, auditory challenges, and other forms of disabilities.
So many things make the cable stand out. We are known, I think most people, if you ask them, what do you know the cable for? They'll mention the speed with which we deliver the news. Some will mention the fact that they look to us for credible news. So, and as a journalist, as a media house, your most important currency is your credibility. I think it's also understanding that the media ecosystem, the industry where we find ourselves, is constantly evolving. And by virtue of that, we also have to constantly innovate. For me, I think that's like the most important thing most important realization that I've come to terms with in the last 3 years plus that I've been editor of the cable, which is that we have to stay ahead of the game. We have to continue to come up with new innovation, new initiatives, new ways of reporting the news, introduce new things every now and then. And this is something that we seek to continue to do.
A lot of organizations, a lot of bodies would claim that they contributed to what I'm today, but I can tell you for sure that the cable made me. I believe that cable is very dynamic and the newspaper is always changing. The future of journalism in Nigeria is going to be really dynamic, and the dynamism of the cable is going to put us in a very strong position to actually not just be a part of that future, but to actually define what that is going to be. I personally, I believe that in the future, a lot of artificial intelligence is going to play in that, a lot of using the digital tools that will define journalism as we go. Of course, the population of people at cable, the demographic, young people, are actually going to define that future. So yes, I believe that the cable is in safe hands.
Through the years, we have remained guided by our editorial values of independence, impartiality, integrity, defense of the public interest, and respect for diversity. This has earned us esteemed partnerships, media collaborations, and a loyal monthly audience exceeding millions, spanning Nigeria, Canada, the US, and the UK. In 2016, our partner organization, Cable Newspaper Journalism Foundation, CNJF, was launched to use the vehicle of journalism to advance transparency and accountability in government, build an active citizenry to promote democracy and development, and pursue solutions journalism.
So the Cable Newspaper Journalism Foundation is a sister organization to the Cable, and as you said, was established in 2016, while Cable was established in 2014. And the mission of Cable Newspaper Journalism Foundation is to use the vehicle of journalism to demand accountability and transparency. The mandate of the Cable Newspaper Journalism Foundation is to train journalists, train them in investigative journalism, fact-checking, multimedia reporting, use the tool of policy advocacy to demand accountability in government. So with this in mind, we work together with the Cable by training the Cable journalists. We provide training and support for the reporters at the Cable newsroom. We also mentor fresh graduates who are interested in journalism. So they spend 1 year interning at the newsroom of the Cable. And lastly, we also fund investigative journalism, investigative reports. The cable is a very, it's not just, it's a brand that is well respected. When you talk about online newspapers, cable stands out. It's not just an online newspaper, it's a respectable online newspaper, and it is read all over the world.
Our commitment to training young journalists has nurtured a new generation of media professionals. Our stories, beyond news consumption, have brought justice to the oppressed, voiced the concerns of the voiceless, exposed corruption, uncovered hidden truths, held powerful institutions to account, influenced policy reforms, offered insights in depth on issues of public interest, and most importantly, we have grown a community of journalists and storytellers that exude the highest ethical standards of journalism.
I've grown. People have taught me a lot. I'm more conscious of my environment. I'm more morally conscious about people. I've learned not to judge people a lot. Like, you have to always hear every side of the story. Don't take sides. It's not your place to take sides. Always hear every angle of the story. Even if you have your own opinion, you don't let it impact what you do.
Joining the cable has been a rewarding experience for me. It has sharpened my reporting skills and then made me a better journalist. Being inside the cable lifestyle, you're able to understand the basics, the fundamentals, rudiments of entertainment journalism.
So the cable is celebrating its 10th anniversary, and I wish that the firm will continue to grow in leaps and bounds. So far, my experience has been really great working at the cable in terms of access, in terms of experience, in terms of capacity. Joining the cable has been truly rewarding. My current role has exposed me to a lot of things. Especially with my network, the network I now have has been incredible. Insight into the kind of stories that are impactful has also been really good because the management team has been very helpful and supportive as well. So it's been an awesome experience within the last 2 years of joining the company. So I do not think there have been any regrets so far.
It's been 10 years of excellent journalism at the cable. At the cable, we set a pace for others to follow. You know, in terms of breaking news, every other person wants to be like the cable. In terms of in-depth analysis, every other person wants to beat us. In terms of fact-checking, in terms of investigative reporting, cable has always been at the forefront. Every other newspaper wants to be like us.
When I joined the cable, I thought I was good at what I was doing, but the cable is like a new school on its own. You do not join this place and live the same way. So I have learned quite a lot. In this country, it's very difficult to run a business. To have sustained a media business for this long takes a lot of effort and dedication. It takes a lot of innovation, creativity, and kudos to everyone who is behind this, to the backroom staff, to everybody who works in the cable to have made this to come to pass. It's actually a very laudable achievement, and it's worth a lot of commendation.
The cable remains dedicated to providing Nigerians and our global audiences with independent, in-depth journalism. Today, we celebrate 10 years of groundbreaking journalism and unwavering commitment to the truth to Nigeria's progress. The cable, click and you shall find.